Hello, I am Dr. Reza. I am performing face and neck lift and upper eyelid blepharoplasty now. I put up more information about this surgery to be spoken by AI while I continue to work because it is very detailed work and I need to focus on my work.
All right, as I mentioned previously, I am working on a face, which is why I would rather use AI to not damage any nerves and to focus on all the small, detailed work that facial surgery requires. In today's video, I'll be sharing some real, unedited moments from a facelift and necklift surgery. As you watch, I'll also be discussing some interesting facts about facial rejuvenation, what goes into achieving natural results, and what patients can expect during the recovery process. You're now watching a series of real-time, unedited clips that I captured throughout one of my facelift and necklift surgeries. These moments are shown exactly as they happened, no fast-forwarding, no edits, to give you a true sense of how careful and detailed this work really is. As you watch, I'll be sharing some interesting facts about facial rejuvenation and what my patients typically experience during recovery. First, it's important to understand that a facelift doesn't stop the aging process. What it does is reset the clock, helping you look more refreshed and vibrant. On average, my patients tell me they feel like they look 15 to 20 years younger after surgery. One of my main goals is always to create a natural result. A well-done facelift should never make you look like a different person. It should simply restore what time and gravity have taken away. You'll still look like yourself, just healthier, younger, and more rested. Many people don't realize that the neck often shows signs of aging earlier than the face. That's why I usually recommend combining a facelift with a necklift, so that both areas look equally rejuvenated. Treating them together creates a more balanced and natural-looking outcome. As you're seeing in these clips, my pace is always steady and deliberate. Every layer of tissue is handled carefully to protect important structures like nerves and blood vessels. Even though these are just segments from different parts of the surgery, the approach is always the same: patience, precision, and respect for the anatomy. Let's talk a little about recovery. After surgery, it's completely normal to experience bruising and swelling, especially in the first couple of weeks. Most of my patients feel ready to return to social activities in about 2 to 3 weeks, although full healing continues quietly behind the scenes for several months. I always emphasize the importance of post-operative care, keeping the head elevated, avoiding strenuous activities, limiting bending or heavy lifting, and protecting the skin from the sun. Proper scar care and, in some cases, gentle lymphatic massage can also help optimize healing. Most of the swelling comes down within the first 3 weeks, but to start feeling confident in your results, it may take up to 3 or 4 months. Emotional recovery is important to mention too. It's very common for patients to feel a bit anxious or concerned early on when swelling temporarily distorts the face and neck, but with time and patience, the final results become more and more visible, and the transformation is incredibly rewarding. You'll also notice that some of these clips come from revision surgery, cases where a patient had prior procedures. Revision work is always more complex because of existing scar tissue and altered anatomy. In these cases, I take an even slower and more cautious approach, making sure every step is as safe and precise as possible. Patients often ask me about mini facelifts or quicker procedures. While those can be helpful for the right person, they typically offer shorter-term results and may not address deeper structural issues, especially in the neck. For lasting, natural-looking rejuvenation, working deeper on the SMAS layer is critical. All the facelifts and necklifts I perform are always SMAS deep plane. In my philosophy, the secret to a beautiful facelift isn't pulling tighter. It's repositioning the deeper structures and letting the skin drape naturally without tension. That's how I avoid the pulled or artificial look that so many patients worry about. Thank you for spending some time with me today, taking a closer look behind the scenes at real facelift and necklift surgery. If you're considering facial rejuvenation, or you're simply curious about the process, I hope this gives you a better understanding of the care, experience, and attention to detail that go into achieving a natural, lasting result. If you'd like to see more behind-the-scenes surgical videos or any other type of content from me, feel free to subscribe and leave a comment about what you would like to see next. I'm always happy to share more about what goes into this rewarding work and to teach people about plastic surgery. Hope to see you in my next video.